The Arlington County Board recessed meeting of March 24, 2020. And we welcome everybody here. There's some changes for today's meeting. At the moment, we often have awards and recognitions and folks with us, but there is nobody in the room right now but us. When we have people, as we did this Saturday, we've got strict kind of spacing. You'll notice up here, we are spacing each other at least 6 feet apart. We do that at all times and when we're in back meeting with each other. So just kind of trying to show how we can carry on, but making sure that we do it in a safe way. This COVID-19 pandemic has drastically altered the routines and rhythms of our lives here in Arlington, across Virginia, and indeed the globe. And I think we all know now that life's not going to get back to normal for some time. We do expect to see a large and rapid increase in cases here over the next couple of weeks, and that increase is not going to really level off, the curve flatten until at least 1 week or more after really strong measures to achieve social distancing, which is really our only weapon for limiting the spread of this virus. So we have to do everything we can to slow the spread of the virus so that our hospitals and medical facilities are not overwhelmed and can continue to function well, to save lives and to treat patients. I've got a couple of graphics that I kind of like. One of them I liked, one of them the manager liked, and I'd like to share those right now and just show you real quickly. They kind of show how it works. We'll see. Ah, yeah, here we go. So this is just shows the huge difference it can make, just a few choices by a few individuals, but it's going to take a lot of these kinds of choices by pretty much everyone to actually stop it. We can try the other graph too, if you can do that, Madam Clerk. There we go, and that's another one, just showing the power of social distancing. We've got to get down to that bottom level. And we're hoping everybody can do this and help us with that. That's why the governor ordered our schools, public and private, closed to the end of the academic year. And we know this is a real hardship for our students and their parents. We're working closely with Arlington Public Schools to get our families the support they need. We're especially focused right now on providing food and support to the growing number of economically vulnerable families. I talk to the chair of the school board, Tanya Talento, pretty much every evening to ensure that they are getting the support from us that they need. We all know COVID-19 has had a devastating impact also on our small businesses, on the people who own them and the people who work for them. We encourage all Arlingtonians, if you can, to support these, like the restaurants that are still able to function by frequenting for carry-out meals. Don't go inside. And we also encourage small businesses to visit the county's COVID-19 resource page for a growing list of resources to help them. We keep working on trying to find other ways to support everyone. And we hope that these resources will soon be bolstered by both state and federal emergency funding. So just another reminder for everybody, maybe you've heard this before, bears repeating. We have to practice strict hygiene. Cannot be said often enough. Wash your hands well and often, in between the fingers, 20 seconds. Wipe down surfaces up here that we're all wiping it down and found the surface has been wiped down about 3 times in the last 15 minutes. Also, just, try not to touch your face. And one thing to remind people, I found myself sniffling a little bit and scratchy throat and thought, oh dear. And then I realized, oh, Libby, this is allergy season. It's beautiful outside. A lot of us suffer from allergies. So if you start to feel some of those allergy symptoms, don't jump to the conclusion it might be coronavirus. We all need to be smart about it. But a lot of people will be suffering from allergies. Small bright spot that I can report, I was on a call with the region with one of the public health officers, and he reported that doctors and hospitals have been reporting less than the usual flu and colds for this time of year, and they're pretty sure that's because people really are washing their hands and trying to be careful because of the COVID-19 virus, and it is having an effect on other things. All of that is really good because it helps relieve the stress and strain on doctors' offices and hospitals. But we still have to do a lot more, which we are now embarking upon doing with so many closures. We still encourage people to get outside safely, stay at least 6 feet apart. And if you're walking in a group or playing on a sports team, that doesn't help. But walking or running or biking with adequate distance between you and others really is great. Good exercise, chance to enjoy the beautiful spring weather we're having. Finally, I think a lot of us know that in a time of anxiety and concerns, one of the best ways to get through is to help others. I've been so encouraged, I think we all have, but not surprised at how creative and proactive our community's been in finding ways to volunteer and help. People have organized food drives, they're checking on their neighbors, making grocery runs, trips to the pharmacies for those who can't get out, and so much more. These acts all pull us together as a community, even as the virus has forced us to put a physical distance between us. I encourage everybody, visit the county website or your local listserv to learn more about what you can do to help, or just check on a neighbor and see if they need anything. Together, we're going to get through this, and our county government will continue to provide core services and continue to look for more ways to help those who are struggling. We thank everyone for their patience and their support. And now I'll call on my colleagues for remarks. Who would like to go first? Mr. Dorsey.
Thank you, Madam Chair, and thank you for that comprehensive report and also guidance for people as they navigate what is just an incredibly unprecedented time for most of us in looking at the effects of this pandemic. And beginning tonight, at midnight, the governor has ordered even more closures and significant limitations and restrictions on most businesses that operate in the Commonwealth of Virginia and, of course, Arlington. The establishment closures and restrictions imposed to corral the spread of COVID-19 are necessary to enable access to care for those who are and become infected with the virus and who experience its most severe health effects. They're also necessary to ensure, as you showed with the graphics, Madam Chair, that we lessen the spread of COVID-19 throughout our community. But of course, this pandemic is not just a health crisis. There are many among us who have already lost their jobs and have seen their incomes dramatically limited. This insecurity extends to current retirees and those who are hoping soon to retire. As a parent of school-aged children, I well understand the challenge we face in providing a continuity of our children's education as well as their own behavioral development without physical access to schools, their teachers, and their classmates. And even if you are safe from worry about a loss of income or health insurance coverage, or you have no immediate retirement security concerns, or you don't have to worry about nurturing school-aged children, we are all adversely impacted by this pandemic. As such, the scale of intervention is going to need to be huge in order to support everyone's well-being. But I know we can do it. And Madam Chair, you outlined some of the ways in which we've already seen our community respond, which have been tremendous. And I would just like to, we can't spend time to note all of the wonderful community responses, but I note as I travel through the community safely that many of our businesses have implemented social distancing norms in very creative ways to ensure that people get access to the goods and supplies that they need in order to effectively minimize their engagement with the wider world. So I want to commend everyone who's really taken this to heart and done their part. It's truly a wonderful community response, and I know our local government is up to the task of ensuring that we look at each and every individual in our community, understanding their needs and understanding how we need to respond in order to promote their well-being. And while we certainly do hope that we don't see further restrictions put in place, everyone should at least be comforted to know that we are preparing for those situations to ensure that we can continue to allow everyone to thrive to the best extent possible during this challenging time.
Thank you, Mr. Dorsey. Who'd like to go next? Mr. DiFerranti.
So just briefly, I appreciate the challenge that's before us, and I think Arlington is rising to that challenge. It's exemplified by our healthcare workers who've been working 24/7, but also in the creativity of the volunteers that are reaching out, trying to make a difference. Our challenge, as I see it, is to get smart as fast as we possibly can on this and as accurately as we can, and then act upon what we learn to prevent the spread of this serious and sometimes, in some cases, deadly disease. So that's our challenge, and we can all enlist in that challenge, and I'm confident that we will. The economic challenge, as Mr. Dorsey mentioned, and as well as Chair Garvey, it's huge. We must acknowledge we're in a new world, and in that new reality that we're facing economically, We're going to have to value every person, and we're going to have to keep that lens that means that those most in need are at the heart of what we are trying to do to serve. So those are just a few thoughts as we approach the coming days. I really do believe Arlington is an extraordinary community, and we can pull together and slow the spread and minimize infections and thereby save lives. That's the challenge, and I think we can do it.
Thank you, Mr. DeFranti. Ms. Crystal.
Yeah, thank you, Madam Chair, for the opportunity. I just wanted to flag a couple of more tactical notes with regard to some of our highest risk and highest need families right now. I know the entirety of county government has been focused on some of the most vulnerable people in our community, and want to particularly commend the work of DHS staff, the Financial Assistance Bureau in particular. I believe that number is widespread in our community to talk to our Emergency Assistance Bureau, but it's 703-228-1350 for anyone who needs it. And in the meantime, we've been doing a lot of conversations, or having a lot of conversations across branches of government about eviction prevention in particular, and just wanted to take this opportunity to amplify that in addition to the state court orders that all new eviction hearings should be suspended, our local GDC, General District Court, has also determined that enforcement of all existing writs of eviction in Arlington and Falls Church have been suspended at least through the 6th of April, and please do stay tuned as more information is forthcoming. Also want to share, as some have seen, and a big thank you to our housing staff, which worked with Ms. Garvey on behalf of all of us to send a letter to our multifamily landlords to ask for their partnership in referring tenants to emergency financial assistance instead of incurring late fees or even threatening evictions. I was really heartened as we received a communication the other day from the Arlington Office and Apartment Building Association that they intend to do just that. We are grateful for their partnership. The only other thing I wanted to flag, unfortunately, we know at times of crisis, and certainly in contexts where people are being asked to isolate in their homes and quarantine themselves, the risk of domestic violence in our community is going to increase. Incidents of domestic violence in our community are going to increase. And just wanted to take, again, the opportunity to put some information out there. Doorways is still running their 24/7 hotline. They still have shelter for anyone who needs it during this time. Health screening will not be a condition of shelter. We may take steps to, or they may take steps to treat or house individuals separately if they have symptoms, but no one should hesitate to reach out to that hotline, which is 703-237-0881 to receive help for domestic violence. They are also working on a telehelp option for counseling survivors. Our FACT unit in Fairfax, which is a regional partner to us for doing evidence collection exams in the case of domestic violence and sexual assault, is still doing acute exams. They are staggering requests, so it's one patient, one provider, standing up telehealth and telemedicine appointments with their ongoing domestic violence patients to see them at home. We are absolutely expecting that the compounding effects of isolation, of stress, of the impact of having children at home, the financial stress and job loss is going to lead to more domestic violence in our community. So we really strongly urge everyone in the community to check on their people and make sure that all are aware that that hotline, 703-237-0881, is still available for people to get help during this time.
Thank you so much. I will say, I think never have I been so grateful for the pretty robust safety net that we've got with nonprofits and our county government. We are being tested to the full. We're finding gaps, what we need to improve, but at least we've got something to start with, and everybody is pitching in. Thank you all for that.